Unlike what many people think, hair transplant is a surgical procedure. Hair from the back of the scalp is taken and separated into individual grafts and transplanted into the recipient area. For a candidate to be chosen for hair transplant, first, hair fall should be brought under control. Hair is transplanted into areas of definite baldness and not into areas of thinning. As long as a candidate could hide his areas of baldness with existing hair, he should defer hair transplant. Grafts are precious and should not be wasted. In what we call the strip method, the donor grafts are harvested in the form of a strip from the back of the scalp. The individual grafts are separated under magnification. Individual follicles are then transplanted into the recipient area. In the strip method, there would be a linear scar at the back of the scalp, and this scar is usually painful for a period of 6 months. Be it strip or FUE, hair transplant is performed under anesthesia. Most of the time, a local anesthesia is sufficient. However, sometimes sedation is added. FUE avoids both the scar and the pain. Medical treatment, be it tablet, lotions or FFB, they have a definite role in controlling hair fall. They postpone baldness. They do not prevent baldness. As everyone commonly asks, how many grafts do I need? The number of grafts depends on the area of baldness. More grafts could be packed inside small area. However, grafts are precious and should not be wasted. The ideal number of grafts are chosen depending on the area of baldness and the density of the donor area. Most of the time, what you see as before and after in the advertorials are usually after multiple sessions of hair transplant. The density after a single session would not be great. The total number of hair that could fall from the temporary zone is as high as 80,000 to 1 lakh. The total number of grafts that could be harvested after multiple sessions could be as high as 10,000 only. Thus, the dilution between 10,000 and 1 lakh. With both strip and FUE, there would be temporary swelling around the eyes and numbness over the scalp for a period of 1 week. With the strip method, there would be a permanent scar at the back of the scalp hidden within the hair. With the FUE, there is no linear scar. However, multiple raised areas become evident if the scalp is shaved.